The American Heart Association has identified a new medical condition that reflects the strong links between obesity, diabetes, and heart and kidney disease. It's called cardiovascular kidney metabolic syndrome. That's a mouthful, so just remember CKM. CKM, that's easy to remember. But here to explain this thing, because most of us don't understand it, is Dr. Payal Kohli. So this is new, CKM, and it's a little hard to understand, but why would the American Heart Association want to put it out there and get people to get it?
As a cardiologist, Kim, I am so proud of this work, and it's led by one of my colleagues from Harvard, who I trained with. And the idea here is that patients never come to my office as a cardiologist until they develop the C. So when they're early in their disease, when they have metabolic syndrome, which is the M, when they have kidney disease, which is the K, they don't get seen by a cardiologist. So we are practicing reactive medicine. We're waiting for the heart disease to manifest, and then we say, okay, now let's put you on the medicine. So the idea of putting this new disease together is a paradigm shift in medicine. It's saying, let's stop treating just our specialty and treat the patient, because all the organs work together. And if the diabetes is flaring and the obesity is bad, that affects the kidneys, which then causes heart disease. And it's sort of like a three-legged stool.
So they're all interconnected. And once you have one, you should be looking for the other?
That's exactly right. So start to look for heart disease when you have diabetes, obesity, metabolic syndrome, because it's just a matter of time before that manifests as heart disease.
So it's more of a full body approach then when you really think about it versus just organ by organ, and then you can really see the different stages. And like you said, how could this possibly help people long term down the line when you see it early?
The prevention piece is huge here. So because you're thinking about the whole body, you're not just treating your specialty. I'm just the heart doctor. You're treating the entire patient. You start to see the disease earlier in its course. In fact, part of this guidance actually suggests screening kids after the age of 3 for kidney disease, because we know that 20% of kids, American kids, are obese. We know 40% of American adults are obese, and we know there's millions of Americans out there with diabetes. So it's actually starting to push that spectrum of screening earlier and earlier. Knowing that heart disease is the #1 killer of men and women, why don't we start looking at it in your 20s, 30s, and 40s when we can modify it rather than waiting till 60s and 70s when it manifests?
So there's a lot of people that struggle with their weight. There are a lot of people that choose to smoke and have a hard time quitting smoking. I would guess then once you make this umbrella, there's a lot of people that could have this CKM.
We're talking about up to 90% of Americans who might be eligible somewhere along the spectrum. There are different stages of CKM. We're also talking about 1 in 3 Americans have more than 3 risk factors for CKM. So this new disease is really making us in the medical community wake up, but it should make you, as population in the community, say, where do I lie along the spectrum of CKM?
And as a cardiologist, what would you say to someone who wants to come in early, right? They see, oh, I have this risk factor, 1 or 3 risk factors. What would you say to them if they want to check it out and see if maybe, they could start doing something now?
I talk to Kim about this all the time, because it is never too early for you to go see a preventive cardiologist and talk about your risk. And that's the idea of here, them making the staging system, which is staged just like cancer is staged. So stage 0 means you're healthy. That's where we really want to be. You have no risk factors. Very few of us are going to continue to stay in that box as we get older. So stage 1 is we're starting to put on a little weight. We're maybe not being as active as we should. Maybe we have some bad behavior, still modifiable. Stage 2 and 3 is when you actually have disease, start to need medications. And then stage 4, you have that heart disease. So catching people in stage 1, maybe early stage 2, that's really when you can make a huge difference. And I like to use the analogy of the train. It's going along its tracks. You make a tiny little change today, and the trajectory of the train in 10 or 20 years is going to be completely different.
So this is a big difference long term for research, but can you go from stage 2 down to stage 1?
You probably cannot reverse unless you're able to lose a lot of weight. So a lot of people, for example, that are on medications for hypertension, they drop 100 pounds, they can get off their medications for hypertension. But really, you're progressing along the spectrum for the most part. So catching it early is really, really important. And this is why we also have what we call a preventive tool. So if you're a healthy person, you're like, hey, I'm not sure about my risk. It used to be, we wouldn't even sit and calculate your risk till you turned 40, because the calculator would start at the age of 40. Now they've changed it in this new guideline. They've put it at 30. What they've also done is added the kidney factors in, because the kidney and the heart are best friends. And if the kidney's unhappy, the heart's going to be unhappy, and vice versa. And they've gone so far as to add what we call social determinants of medicine. So access to care. If you're not able to afford your medicines, if you live in a food desert, if you're living in a lower socioeconomic status, it's going to affect your health. It's going to affect your ability to take care of yourself. So all of these are now put into this calculator, and we're looking at risk not just over the next 10 years, but over your lifetime, to say, hey, it's really, you're 25 or 30 today, but look at all these risk factors. We're headed for a bad destination. Let's make some changes.
Oh, it's coming.
Yeah.
Gravity is real too. But no, I appreciate it, because you do remind us all, and we just hope more people get access to the care they need to get those things. Thanks, Dr. Kohli, as always.